So some of the problems we had as physicians in completing driver's medicals is that we've never had a good objective way of trying to detect cognitive difficulties that may be affecting somebody's ability to drive safely. So in our clinic, when we were piloting this new tool called the SIMARD MD, we, prior to that, did not have a good way of knowing if our clinical judgment was accurate. And so patients that we thought we knew very, very well, that didn't seem to be an issue with any cognitive abilities, would often surprisingly have a lot of trouble on the screening tools.
The way that the SIMARD MD was constructed allows a physician to make determinations based on cut points. And I think that a tool that has been scientifically tested, has been verified as being able to do that, will be a very powerful tool to have in the physician's office. And the reason that was so important to us is it allows us that other level of confidence that we can take it forward to our physicians and actually integrate it into busy family practices.
The initial concerns with administering the SIMARD was that we were concerned the physicians would have a much increased workload, and we were pleasantly surprised to see how easy it was to integrate it into the clinic. We do have a team of nurses, and as part of a primary care network have a bit of an advantage in that we have that team. And so the physicians actually don't have any added work. The test is administered by an RN, and the report is given to us prior to entering the patient room. So the workload was actually not any greater for us, so that was a very pleasant surprise. We were also concerned that our patients would not be receptive to this new tool called the SIMARD MD, and we were quite concerned as a group that our clinic may develop a negative reputation around this, and mostly concerned that we'd have a reputation of being the driving police. We were pleasantly surprised to see that the vast majority of patients actually had no trouble at all having this test administered to them, and we have not had any kind of negative impact on our reputation or the clinic. And it's been a very positive experience.
I think that there's some truth to the fact that what the SIMARD MD has allowed us to do is to start asking the questions and focusing the patients and their families on the fact that their loved one may no longer be able to drive. And even the process itself allows, I do believe, allows patients and families to realize that there are difficulties and problems to the point where a lot of times they're quite willing to say, it's time for me to quit driving. It seems to have smoothed over the whole conversation a little bit. And either way, whether the person fails the driving examination or whether they pass it, I think you're in a much better relationship with the patient having taken that time. If they don't pass, then you've already started the conversation of having that license end.
Prior to having the SIMARD MD, when I would complete a driver's medical, I used the best of my judgment and clinical examination to determine if I thought somebody was fit to drive. I never quite felt completely comfortable in a lot of situations, but I really had no other objective way of testing. So I would do what most physicians probably do and just sign the form and trust that we made the right decision. Now that we have the SIMARD MD, I don't have as many concerns when I leave the office at the end of the day after having done a few driver's medicals. And I would suggest to any physician who's having any hesitation like I was to give this tool a try, because I think they would find it's a very easy tool to use and definitely gives some good objective evidence and makes your confidence in signing that form more positive.